UKIP spokesperson Caroline Jones.
Cabinet Secretary, the second Wales Cancer Patient Experience Survey has once again highlighted the fact that many cancer patients still do not have a key worker. And while we have made progress, 14% of patients still don't have a key worker, and more than a quarter of patients said it was often difficult to contact the key worker. The survey also highlighted the benefits patients found in having a clinical nurse specialist, with the majority of the 81% of patients who had one stating that their treatment was greatly improved due to this. As a result, Macmillan Wales is calling for every person with cancer in Wales to have access to a clinical nurse specialist. Cabinet Secretary, do you support this view, and do you agree that the clinical nurse specialist should act as a key worker for Welsh cancer patients?
We certainly want every patient where a clinical nurse specialist is appropriate to be part of their care to have one. The challenge about whether the clinical nurse specialist is the key worker, I think, is different, because for some people it need not be the clinical nurse specialist who acts the key worker, although in practice, in the great majority of cases, it is the clinical nurse specialist who undertakes that role. And there's been a significant improvement on people knowing who their key worker is. In the previous cancer patient survey in 2013, 66% of people knew who their allocated key worker was. In this survey, that's gone up to 86%. And again, this is a significant undertaking. Over 6,700 staff have given up their time to provide their view on a wide range of their own experience of cancer care. And it's as a result of this wide-ranging survey that we're able to understand the state of our current services, the areas where we've improved, and equally those areas where we still need to improve further in the future.
For that answer, Cabinet Secretary, and staying with the Wales Cancer Patient Experience Survey, nearly a quarter of patients said that their GP didn't take their symptoms seriously before their diagnosis. In fact, 6% of patients stated they had to see their GP at least 5 times before being referred to hospital. As stated in the Cancer Delivery Plan, detecting cancer earlier makes it more likely that treatment can be curative, less intensive and less expensive. It is therefore vital that when someone presents with symptoms that could be caused by cancer, they are taken seriously. Unfortunately, we seem to operate in a model where we rule conditions in rather than out. We work up to the most serious rather than working back. So, Cabinet Secretary, what more can be done to improve early cancer diagnosis in primary care?
I don't think the way in which you characterise the way that general practitioners approach their job is particularly fair. I do think there is a serious case, though, about improving the number and the quality of referrals. And this is a really big challenge for the health service, because the overwhelming majority of people referred in with suspected cancer are actually given the all clear. So we already have a significant undertaking where we're looking for the minority of people who are referred in who are then told that there is a form of cancer for them to be treated. And I think sometimes that's lost. It's also the case that the cancer referrals have gone up significantly in this last year. They're up 12% within this year alone. And it is about how we continue to improve the rate of referral, but also what the conversion rate is as well, because within health boards there are different referral rates, but also different conversion rates. Sorry, for those who aren't aware, the conversion rate is the number of people who are referred in and then go on to be told that they have a particular cancer. That may be about the communities themselves. It may also be about the numbers of people and how and why they're being referred in. It's really important, again, that we have a properly reflective approach where general practitioners are able to talk to each other and other actors within the service to understand what is happening and the outcomes they're delivering for their patients. And I think it's got to be a properly reflective and supportive approach, as opposed to looking to say that there will be blame apportioned to GPs who are being told they're doing their job in the wrong way. I think that's unlikely to see the sort of reflective and positive approach that people want to take. And let's not forget, these are people who make a choice to go into medicine, to care for people, to help improve lives, and we need to help them to do their job, as well as being properly reflective on where that improvement is required.
Thank you, Cabinet Secretary. And finally, less than half of cancer patients had the opportunity to discuss their needs, and only 18% of patients were offered a written care plan. Care plans are not only focused on healthcare needs, but they also pick up on emotional, financial and practical support. And less than half of Welsh patients were given information on financial support and benefits, or had the impact their cancer would have on their day-to-day life discussed with them. We need to improve the way we deal with the impact cancer has on the patient, not just on their physical health, but the broader aspects. So what is your government doing, Cabinet Secretary, to ensure that all patients are offered a written care plan which incorporates a holistic needs assessment?
We set out clearly our expectations for improvement in the cancer delivery plan. There's no dispute within the wide range of healthcare professionals in tertiary, secondary and primary care services of the need for improvement, or in the real value of having written care plans. And it is indeed because people see the whole person. So not just the particular direct impact of cancer in terms of treatment terms, and what that means for that person, their ability to work, their ability to live their life, to make different choices, and actually their prospects for the future. And so it is really important to have that wider discussion and to understand that will be at different points in time for different people. Some people at the point of diagnosis may want to know everything. Other people may want to get out of the room as soon as possible. And it's understandable why that happens. And that's why a service has to be not having a one-size-fits-all approach, to be more agile and to be wrapped around that person. And it also reiterates the need to have not just primary care and hospitalist care in a proper and constructive relationship with each other, but actually the real value of people in the third sector are able to support people in a different way, in a non-medicalised setting. But I do think that it's important not to lose sight of the fact that more people are being referred for cancer, more people are being treated for cancer, more people are treated in time for cancer, and more people have better outcomes. More people survive now than ever before. And actually the experience of care, 93% of people have a good experience of cancer care here in Wales. So more improvement required. I accept that completely, but let's not try and say that everything is bad here. We have many things to be very proud of.
Question